What a doctor specializing in oral medicine do. A doctor specializing in oral medicine, often referred to as an oral medicine specialist or oral medicine and oral pathology specialist, is a medical professional who focuses on the diagnosis, management, and treatment of various diseases and conditions affecting the oral and maxillofacial regions, as well as systemic conditions that manifest with oral symptoms. These specialists have expertise in recognizing and addressing complex oral health issues and their connections to overall health. Here are some key aspects of what a doctor specializing in oral medicine does. Diagnosis and assessment. Oral medicine specialists conduct thorough evaluations of patients with oral and maxillofacial symptoms, such as oral lesions, ulcers, red or white patches, or other oral abnormalities. They use clinical examinations, medical histories, and diagnostic tests to make accurate diagnoses. Oral lesion diagnosis. They are skilled in diagnosing various oral lesions, including precancerous and cancerous conditions. Biopsies and other diagnostic procedures may be performed to determine the nature of the lesion. Oral infections. Oral medicine specialists diagnose and manage oral infections, including viral, bacterial, and fungal infections that affect the mouth and surrounding tissues. Oral mucosal disorders. They evaluate and treat a wide range of oral mucosal disorders, such as lichen planus, pemphigus, and mucous membrane pemphigoid, which can cause pain and discomfort. Salivary gland disorders. Oral medicine specialists manage conditions related to the salivary glands, including salivary gland tumors, salivary gland stones, silolithiasis, and conditions leading to dry mouth, xerostomia. Oral manifestations of systemic diseases. They recognize and evaluate oral symptoms and manifestations of systemic diseases, such as autoimmune disorders, nutritional deficiencies, and connective tissue disorders. Oral pain management. Oral medicine specialists address chronic orofacial pain conditions, including temporomandibular joint disorders, DMD, burning mouth syndrome, and neuropathic pain conditions. Medication-related side effects. They assess and manage oral health issues related to medications or medical treatments, such as chemotherapy-induced oral mucositis. Oral health in complex medical cases. Oral medicine specialists work as part of interdisciplinary healthcare teams to address oral health issues in patients with complex medical conditions, such as cancer patients, organ transplant recipients, and those with immunocompromised states. Oral health education. They provide education to patients about oral hygiene, preventive measures, and the relationship between oral health and overall health. To become an oral medicine specialist, a doctor typically completes dental or medical school, followed by specialized training in oral medicine and oral pathology. This training includes clinical rotations, research, and extensive experience in diagnosing and managing oral and maxillofacial conditions. Some oral medicine specialists may also pursue dual degrees, DDS and MD, to gain expertise in both dentistry and medicine. Oral medicine specialists play a crucial role in early diagnosis and management of oral diseases and conditions, often serving as valuable consultants in complex medical and dental cases. Their expertise is vital for maintaining both oral health and overall well-being.